Heart disease remains the leading cause of death worldwide, especially among adults over 50. But the truth is, most heart problems don't appear overnight. They develop slowly, showing subtle warning signs that many people ignore until it's too late. In this video, we'll look at the 10 early warning signs of heart disease after 50, so you can recognize them early and protect your heart before serious damage occurs. Before we begin, make sure to subscribe to our channel, like this video, and turn on the notification bell. We post science-backed health tips every week to help you live a longer, stronger life. Let's get started. First, chest discomfort or pressure. Chest pain is one of the most common and classic symptoms of heart disease, but it doesn't always feel sharp or severe. Many people describe it as a pressure, tightness, squeezing, or burning sensation in the center of the chest. This happens when the heart muscle doesn't get enough oxygen-rich blood, often due to a blockage in the coronary arteries. The discomfort may come and go, especially during physical activity or emotional stress, and improve with rest. If you ever experience chest discomfort lasting more than a few minutes, even if it's mild, it's important to seek medical attention immediately. Could be a sign of angina or even a heart attack. Second, shortness of breath. Feeling breathless while climbing stairs, walking, or even at rest can signal early heart problems. When the heart can't pump blood efficiently, fluid may build up in the lungs, making it harder to breathe. You may feel out of breath more easily than before or notice that you can't exercise as long as you used to. This is a red flag for heart failure or coronary artery disease. Sometimes shortness of breath appears without chest pain, especially in older adults or women. Don't ignore it. Talk to your doctor if you notice a change in your breathing pattern. Third, fatigue or unusual tiredness. Chronic fatigue that doesn't improve with rest can be one of the earliest and most overlooked signs of heart disease. When your heart is struggling to pump efficiently, your muscles and organs don't receive enough oxygen. This leads to persistent tiredness, even after doing simple daily activities. Many people, especially women, report feeling worn out or weak weeks before a heart event. If you feel unusually tired for no reason, especially with lightheadedness or shortness of breath, don't dismiss it. Your body could be signaling heart trouble. Fourth, swelling in legs, ankles, or feet. If you notice your shoes feeling tighter or swelling around your ankles by evening, it could be more than just aging or salt intake. This condition, known as edema, happens when the heart isn't pumping blood effectively, causing fluid to accumulate in the lower body. Swelling from heart failure often appears symmetrically in both legs and may worsen after long periods of standing. In some cases, you might also notice weight gain due to fluid retention. Don't ignore this. It's a sign your heart and kidneys may be under stress. Fifth, irregular heartbeat. Your heart should beat in a regular, steady rhythm. But if you frequently feel fluttering, pounding, or skipping beats, this could signal an arrhythmia, a disorder of the heart's electrical system. Occasional palpitations from caffeine or stress are common, but persistent or unpredictable ones, especially with dizziness, weakness, or chest pain, can indicate atrial fibrillation or ventricular irregularities. Atrial fibrillation increases your risk of stroke and heart failure, so it's essential to monitor your pulse and seek evaluation if something feels off. Sixth, dizziness or lightheadedness. Feeling dizzy, faint, or lightheaded can occur when the heart isn't delivering enough blood to the brain. This may result from low blood pressure, irregular heartbeat, or narrowed arteries. You might notice the symptom when you stand up quickly, during exertion, or randomly throughout the day. If dizziness happens often or comes with chest pain, blurred vision, or shortness of breath, could be an early warning of cardiac dysfunction. Always take it seriously. Seventh, pain in the neck, jaw, or back. Not all heart symptoms show up in the chest. Some people, especially women, experience pain in the jaw, neck, shoulder, or upper back during a heart attack or angina episode. This happens because the heart shares nerve pathways with other areas of the body, leading to referred pain. The pain might feel dull, heavy, or like pressure rather than sharp. Can spread to one or both arms, especially the left side. If you ever feel unexplained pain or discomfort in these areas, particularly when exercising or under stress, seek medical evaluation promptly. Eighth, persistent cough or wheezing. A long-term cough, especially one that produces white or pink frothy mucus, may indicate heart failure. When the heart weakens, fluid can leak into the lungs, causing a buildup that triggers coughing or wheezing. Unlike a cold or allergy-related cough, this type doesn't go away and may worsen when you lie down. If your cough persists despite treatment, it's worth checking your heart function, especially if you also have shortness of breath or leg swelling. Ninth, indigestion, nausea, or stomach pain. Many people are surprised to learn that heart disease can cause digestive symptoms. This happens because of reduced blood flow to the digestive system during a cardiac event. You may feel nausea, heartburn, bloating, or stomach pain, especially after meals. Women are more likely than men to experience these symptoms before or during a heart attack. Because they resemble normal digestive issues, they are often ignored, but when accompanied by chest pressure, fatigue, or sweating, they may indicate heart distress. 10th, excessive sweating. Breaking out in a cold sweat, especially when you're not exercising or in a warm environment, is another red flag. This happens when the body goes into fight or flight mode due to reduced blood flow and stress on the heart. The nervous system reacts by producing sweat to cool the body down. If cold sweats come with chest pain, nausea, or shortness of breath, call emergency services immediately. Could be a sign of a heart attack in progress. Bonus, sleep disturbances and sleep apnea. If you often wake up gasping for air, snore loudly, or feel excessively tired during the day, you may have sleep apnea, a condition that disrupts breathing at night. Sleep apnea forces the heart to work harder and is strongly linked to high blood pressure, arrhythmias, and heart failure. Proper diagnosis and treatment, often through lifestyle changes or a CPAP machine, can significantly reduce your risk of heart disease. Why these symptoms matter. Many people ignore or misinterpret these symptoms as simple aging, stress, or fatigue. However, when your heart struggles, it often sends early signals long before a major event occurs. Recognizing these signs early gives you the best chance to prevent a heart attack or heart failure through timely medical care, dietary changes, and exercise. Remember, the heart is incredibly resilient. With the right attention, even damaged heart tissue can improve over time. How to protect your heart after 50. Besides recognizing symptoms, adopting a heart-healthy lifestyle can dramatically lower your risk of disease. Here's how to keep your heart strong every day. Eat a balanced diet. Focus on fruits, vegetables, whole grains, and lean proteins. Limit salt, sugar, and processed foods. Stay physically active. Aim for at least 30 minutes of walking or light activity most days. Maintain healthy weight. Even small reductions in body fat lower strain on the heart. Manage stress. Meditation, breathing exercises, and sleep help regulate blood pressure. Avoid smoking and limit alcohol. Get regular checkups. Monitor blood pressure, cholesterol, and blood sugar levels regularly. Conclusion: heart disease doesn't happen suddenly, it builds up silently over years. By paying attention to these 10 warning signs and making heart-smart lifestyle choices, you can dramatically reduce your risk and enjoy a longer, healthier life. Your body always tries to communicate with you. The key is learning to listen. If you found this video helpful, please like, subscribe, and share it with others who care about their heart health. Together, we can spread awareness and help people recognize the early signs before it's too late. Thank you for watching. Stay healthy, stay strong, and take care of your heart.